All right, good evening, everyone. I probably won't do as good as Neil. Hopefully, can everyone see the screen I'm sharing? Okay, thank you very much. So services. So Hood River Fire and EMS provides both fire and EMS services to the city, as well as we provide EMS services to 145 square miles in both Hood River and Wasco County. So up to Odell and then through the town of Mosier. So you can think of it that way. In 2020, we responded to just about 1,700 incidents. And you can see by the breakout, almost 80% of our calls are medical related, and nearly 20% or just over that is fire related. Some outcomes of last year, things that we have been working on are utilizing our GIS system, thanks to Jonathan. This has really helped us improve our response and recovery. It helps us target certain hazards as well as develop pre-incident plans. Additionally, COVID. When COVID started, we started with developing response protocols and helping with Dr. Benzinger, our physician supervisor, and the rest of the county EMS providers, solid protocols to follow for suspected people with COVID, as well as working with our Hood River County 911 system to improve information gathering so we know what we're walking into. And also during this year, if you remember a few years back, we started a FEMA grant system, applied for an AFG grant, was awarded it. It was nearly $600,000 to replace our aging air packs for the entire county. I authored that FEMA grant, managed the FEMA grant, and during COVID, we distributed these air packs, collected payment, and that saved the taxpayers of Hood River County almost $600,000 total. So that was a huge win for the county. Like Chief Holste, we participated in school Zoom calls. So we provided, I wish I had pictures of it actually, I will say creative outlets for various teachers through the West Side and Main Street schools, as well as providing station tours on YouTube. So that was an interesting response to a pandemic that we definitely didn't think we'd be doing. So speaking of COVID-19, we had the first cases in Hood River County in March of 2020. And then during last year, we had two significant spikes, some in July, and it's this little small bump compared to our total call volume, as well as in December. And to date, as of today, we've taken care of 118 patients that were COVID positive. And that does not include COVID or suspected COVID as well. So like we discovered with toilet paper, our PPE was a challenge to obtain as inventory dwindled, especially across the nation and locally. But in true community fashion, the public stepped up to assist, from Gorge Sewn to create the masks, that's what you see on the picture on the left, to Maui Myers and his group creating the gowns, from Tyvek building material, and SailWorks produced those face shields that you see with 3D printers. So the community stepped up to protect your firefighters. So these efforts were invaluable to the staff here in the station, as well as to the county. And their work really helped us bridge that gap until we got the major supply chain back up and running. So in November, so just about, I guess, 6-7 months ago, Hood River County EOC, with Barbara's help, did a grant, and Hood River Fire received 3 of these PAPRs. That's what you see these two gentlemen wearing. They are powered air purifying respirators, and we wear these on all suspected COVID patients. And this is a huge deal. And I will note the timeline is in November. So a month before our biggest spike in December, we received this critical piece of safety equipment. Also in December, the members of Hood River Fire, as well as Hood River County, were lucky to get shots as the first group of being 1A. And it came at the perfect time, right when we were getting our largest surge in the county. So council work plan. One of the goals being equitable and an inclusive community. I just wanted to touch this with the council and the budget committee. We are working on community health, as well as a behavioral health partnership with the entities that you see on your screen. The big change for us, though, is we're working, and tomorrow at a county fire chiefs meeting, we're going to finalize our contract, but we're changing our reporting software. And this reporting software will be able to talk with Epic, which is the major hospital language. And in turn, we'll be able to track things a little bit better. And those that are in charge of helping our most vulnerable population will be able to know our activity, as well as we'll be able to identify places where we can partner and share this information, especially to improve delivery of services. So with that, do you guys have any questions?
Chief, this is Mark. You've been spending the last few years getting the EMS thing all centered up, and I see the revenue looks really good. Can you talk just a little bit about whether it's, fully self-supporting, which is the goal, or are we still working in that direction?
I will let Will answer the self-supporting question because I think that would be a better answer for him to pull up. But I will say several things. From starting here, we've done more interfacility transfers. With that was the approval of you guys saying we could have more staffing. Right. So I will say that's become kind of a runaway train. Part of it this year being super high because of COVID and a bunch of other things. But we are a majority player in that space, but it's also putting a pinch on some staff. But we average one of those a day. So that workload is high at times, but that's an average. But some days we'll get 3, some days we may get none, but one a day for sure. And that's definitely helped. 2, we improved our billing company. So that reduced fees by quite a bit. Just with our normal call volume, that was almost $40,000 of increased revenue, almost to like what Neil was talking about and looking for efficiencies in different contracts. That was one for sure. And the third one, which Will can talk to specific numbers, is Oregon 2 years ago started GEMT, which is ground emergency medical transport. Gary Reed's, I know, very familiar with that term. And that's allowed us to get the bridge gap from Medicaid, Medicare for when we transport people, and we charge a fair amount of money, but Medicaid only pays us $350. And so every one of those, whether it's an interfacility transfer to Portland or a ride to the local hospital here, it's $350. And so that barely covers costs of materials as well as depreciation of a vehicle and salaries and all those things. And a federal government reimbursement program, I'll just say roughly gives us nearly $50,000 a year. And then next month, or I should say, sorry, at the end of this month, the state of Oregon is having a meeting at the state level about a different reimbursement model, which is a CCO model. And I know I've shared some numbers with Will and Rachel, and we'll see where that goes, and that will make things even different moving forward as far as in the positive, I should say. So I hope I answered that question for you, Mark.
That's
we're
cool.
Doing a good job, much, I'll say better than it probably was for sure. And I hope it illustrates the good work that these men and women here are doing.
I think council was fully supportive of you growing that with that goal, and I'm just happy to see you still smiling about it, and that it's so.
And I would add, thanks to the chief's leadership, we are going to look at our EMS system in this next year, because while it is one whole system, EMS is the majority of what we do, and fire suppression. Well, it is in a whole system. There are issues that are specific to Hood River. So the proximity that we, to Portland is one issue for all rural communities that takes our folks out of service for a really, really long time. And then the kind of the condition of mutual aid, I guess. So what else is happening throughout the county that may impact our ability to provide those services? So we do have some professional services identified, and that's something, this continuous improvement model that we're going to be looking at specifically in the next year.
I've got a question. Thank you, Chief. You as the police chief, you have a more or less a flat budget this year. I worry. I live on the outskirts of town, and I worry a lot about our elevated wildfire danger and what the danger it poses to residential communities. We're surrounded, right, by by fuel. How are you guys planning for and accounting for, and what's our strategy from a budget and just tactical standpoint about managing the elevated wildfire danger that we seem to be under? And every year I don't enjoy summer anymore. I'm worried about it. How do you think about that, and how does the money flow in this direction to reduce the risk to the community?
Thank you for that question, Rudy. Actually, it's perfect timing. The state level, I'll start high and I'll go down low to the local community. The state fire marshal's office has identified that. I think the fires that occurred last year in Clackamas County really illustrated, I'll say, some shortcomings, and we can talk about public safety power shutoff, which I know Councilor Saunders loves to talk about, but it really highlighted some inefficiencies both at the state level with communication and wildland urban interface planning, assets and fuel mitigation processes, that sort of thing. We should hear any moment about some people that were hired and specifically for these large areas at risk, which Hood River County, Wasco County is one of those identified areas. So there'll be a state concerted effort at that with focus on fuel mitigation and other aspects within the urban interface. Hood River County is overdue for a CWPP, so Community Wildfire Protection Plan. We're just a few years past due, but we've had some challenges, right, as a county, both with responding to different emergencies. So bar bears has been maxed, but I would look forward to that coming as well. So that comes with us flying over Hood River County, getting updated WUI risk maps, that sort of thing. And that still may be handled at the state level. I don't know that yet. Hood River specific to the city, that same map I'm talking about, we work hand in hand with the building official to improve both building code and building materials, roof coverings and fuel away from homes to make sure that those homes that are being built in that area aren't propagating that risk and making things worse. All of those things are happening. I know the planning director is also working on some things. It doesn't forego the risk. I think Eagle Creek woke this entire community up. And we can go into, I'll say, mass evacuation and how we go about that, notification systems. There's a lot of those things. But I will say the state is trying to have, where we have Everbridge locally, to have a state system to where Neil talked about, the police chief talked about FirstNet and how we have priority use of cellular stuff. It also goes in hand with those that are on different cell carriers, how they get notified. So they're trying to make things a seamless system so we don't have a patchwork where if you are from, let's say, Multnomah County visiting Hood River County and you're staying here and something happens, how do you get notified? There's those types of factors that come into play as well. But for the citizens, I will say that's first and foremost. I know the city manager and I have lots of conversations about this action and what's going on. Do I worry about development as we move west? To some extent, but I think we're doing a good job with addressing those risks. And I'll let Rachel talk a little bit about ODF if we want to get into that as well. But I will say relationships with our partners from the Forest Service on the federal side, as well as ODF on the local side, to the fire districts locally around us. We all are working on improving that process and notification, especially for the citizens that are living in those areas.
I'm happy to mention this, Leonard, and jump in if I use language that's not quite technical, but the state, Oregon Department of Fish and Wildlife, right?
Forestry. See?
So many agencies. They are actually reclassifying some of the properties within the city. So those properties will pay an extra very small assessment and get additional fire protection from the Department of Forestry, should there be a big wildland fire in our area. So that is coming. There will be public meetings about that. And Mayor, it looks like you were pointing to yourself as being one of those properties.
Yes, I was notified and we looked at it and they said, oh, you might get a $50 a year charge or something. And I'm like, it's worth 4 times that much. If we could be protected, we live in the Indian Creek drainage right up to our house. And, that's cheap insurance to pay in my opinion.
Yeah.
Everyone
and those are those are the resources that the city does not have access to that we would need in the event of something large. You know, they bring in the planes and drop the water, and that's just something that a city of our size would never have resource wise.
Yeah, and a few years ago when we had a fire out on West Cliff, it brought that to light with the cost of aerial apparatus and a spotter plane and a hand crews, and it was for several days. And if that was the case within the city, it would have been a different story. So there's a lot of those assets that are just outside the city. Sometimes that exist at the airport that would be at our ready for when or if this ever happens. So that's what that relationship we're referencing on working on.
And no, the fire chief did not request a helicopter in his budget or a plane.
But it is in the vehicle replacement. I'm kidding.
Thank you for that.
Councilor Meta, and then I guess Gladys. Oh, and the mayor. I'm not sure who was first. I'll let you guys decide.
All right, I don't hear anything, so I'm just gonna go.
Okay, good.
Thank you, Chief. I appreciate your presentation. So Chief Holste did a wonderful job of showing us how the officers engage with community members from school children all the way up. How does the fire department do that? I see that you have a volunteer expenses and it's about $6,800. What are those dollars used for, and how do you establish trust how does the department establish trust with our community members, kiddos, all the way up to our elders?
Sure. I think I will say this. I know Neil does a way better job than I do capturing that in pictures. With the principal at May Street with Kelly Beard, we have done luncheons. Crews have done that for several years, as well as the school walk, et cetera. Same with Westside Elementary, though that sits outside the city limits. We'll partner with Westside Fire District. That's one. We do a lot of visits at care facilities, fall risk reduction and those types of things. But I'll tell you, I'm really poor at taking those pictures. I'm busy with other things. And I know that I don't ask other people to take those pictures as much. And I've honestly have focused on other efforts. But to answer your question about the volunteer thing, and you probably remember at one time we had a robust volunteer association that did a bunch of those things. And we had people, including like yourself, that helped with citizen CPR, whether it be English and Spanish. Unfortunately, a lot of those programs have left when some people have left as well. And it's really hard to recruit volunteers to fill those special roles, especially when we're looking at bilingual services and that sort of thing. But back to the community, you talked about what else are we doing? I've been on Radio Terra several times. We do a lot of different, but obviously COVID, this last year, it's been really difficult for me to draw upon that. But similar stuff to what the police chief had talked about, Zoom calls, YouTube station tours, et cetera. But the volunteer line item specifically, we have a lot of EMS volunteers. That's changed in the last few years, really to help the workload of the staff doing those interfacility transfers that take 4 to 5 hours every time. And so those volunteers, they need to have the background check and physicals and that sort of thing done. And that's where that line item comes in.
And in our next newsletter, there will be an article about the volunteer program at the fire department, which is pretty unique and a great program. So look forward to that coming out. Thanks for your leadership on that, Chief.
I was going to ask about the uniforms and the contract services line. I was guessing it's just time for some upgrades, but if you could talk about it.
Upgrades with the uniforms or the?
Yeah.
I guess I'm not sure what you're asking or how that line item is used. Is that what you're looking for?
No, I guess why is the uniform so much higher in the contract services?
This upcoming budget, we're going to be improving our wildland protective equipment. So our PPE for wildland. So from helmets to boots to all those other things. That's the big one there. Will might be able to help with the drill down further of that, but that's the big increase. That line item has gone up. Is specifically solely for wildland PPE and time for upgrade.
Yep, that's a one-time, not a structural purchase of a lot of wildland personal protective equipment for, yeah, fighting wildland fires.
And the contract services, that's what I was wanted to ask about too, was about $20,000 higher than last year. Is that something specific?
That is mainly because we switched when we had an EMS and fire budget. A lot of the contract services being pulled out of that as a monthly hit for our ambulance billing company. That's one. Same with professional services. There's not much difference other than what Neil had expressed as far as what is in it within a contract. We try to make it a contract service. One-time hit is try to be professional services, but there's definitely a blend between the two.
That the bump from year to year is the rural ambulance consultant to do the evaluation that we just mentioned earlier.
Otherwise known as GEMT, but that
Okay.
other one too as well.
Okay. And the fringe benefits we don't have that anymore.
Yes.
What is that, Will? What is that?
Thank you. I should have put that into the intro. There's one other change. And I may have simplified some things in the budget, but sometimes there's usefulness to breaking things out a bit more. And so all departments, fringe benefits is all of these things. Now I'm actually breaking them out. And
Oh, okay.
now you'll be able to see how PERS is changing versus health and dental and life versus those other things. And one other change we'll get more into on the third meeting when we talk about other funds is the update to the financial policies in 2020. We moved saving for compensated absences as we kind of had a very crude formula and we would transfer into a compensated absence reserve. And so that would show up as transfers. We hired the same folks who did our utility rate study. We hired them to create tailored payroll charges for each one of the bargaining groups and non-represented based on how quickly they accrue compensated absences that may need to be paid out in the future. And so we have payroll rates applied there that money will go into an internal service fund that will pay out compensated absence when folks leave employment versus it coming from the reserve fund. So that's what that's all about.
Great. Much more accurate, probably.
It is, yeah, because the bargaining groups have bargained much different compensated absence accruals. And so there is quite a bit of difference sometimes in the payroll charge, that the appropriate charge to that department to pay those out, that sort of hidden liability that's accruing.
Any other questions? Okay, well, thank you guys for the opportunity. It's been a wonderful year.
Okay, next up we have the planning department. So Dustin, you can share